sagittal, lumboid. All right. Then the bones, you have to know them: frontal, parietal, occipital. Okay. We have one also suture coming on the side. They call it squamous. Squamous suture, and we're done with the sutures here. All right. So that's what you need from the skull cap. Okay. Then we're gonna go to the skull itself. So what I can do, I can start the base of the skull here, then we can go to the outer part, okay? This part here, which is, I think number 56, is crista galli. This is where the dura mater attach. Because remember, dura stuck to the lining here, and we have to attach it to anchor it. So this is the point of anchor. They call it crista galli. Okay. Now, today I talked about the cribriform plate of ethmoid. Can you guys see kind of like dots? Mm-hmm. Those, the olfactory neurons, they're gonna go through them and end up in the bulb that you saw it on the sheep brain, on the mitral cells. Remember, inside the bulb, they make a synapse. Okay. And this line, you see it? This line, perpendicular plate of ethmoid. You see that sharp line? Mm-hmm. Now this goes all the way down. So from your angle, you can see, see that line in the center? Sharp? That's same thing. So if I point here, perpendicular plate of ethmoid. If I point here, you say the same thing. Mm-hmm. Perpendicular plate of ethmoid. Okay? Mm-hmm. Yeah. Okay. So let's continue here. Now we have ethmoid sinus here sitting in. Of course, if you cut this bone, want to see inside, it's air cells. It's, you know, cells filled with air. Make my skull lighter, of course. Now we're gonna go here. We have the sphenoid bone, and you can see the outline of it, guys. You see that line and that line? I like those skulls because they use them for forensic much better than the one even inside there. So you see that's the outline of the sphenoid. They call sphenoid because of the wings. Mm-hmm. So I have lesser wing of sphenoid and greater wing. Look how big is this wing and how small is this wing. Mm-hmm. So lesser wing of sphenoid, greater wing of sphenoid. Okay? Now you're gonna see a foramen here. Okay? What foramen is that? You can see it from here. Optic. Can you see the tip of it? Yeah. So optic nerves, they go in, crossing, make a chiasma. You saw it also in the sheep brain. Okay. And this one, okay, is a groove that your pituitary gland sits on. So if you call it hypophyseal fossa, it's fine. I accept it. All right. So this one, if you also write it, sella turcica, I also accept it because you mean the groove. If you put hypophyseal fossa, which is the groove for pituitary gland to sit on, it's also correct. Okay? And we have the anterior clinoid and posterior clinoid. I'm not sure if I added this for you, but check it out. Okay? Then, don't forget, we have 3 fossa in the cranial cavity. Anterior cranial fossa. What sits in this? Frontal lobes. Middle cranial fossa. What sits in this? Temporal. Temporal, that side. Now, posterior cranial fossa. What sits? No. Occipital. Which one?
Parietal.
Why parietal? Parietal is on the side, guys. This is back. What's below the cerebrum?
Oh, that's your cerebellum.
Cerebellum. And look how small it is. So cerebellar hemispheres, they sit here. Above them, yes. So it's gonna be here, in the posterior here, occipital. Yeah. But those designed for cerebellar hemispheres to sit on. All right. So those are the cranial fossa, foramen magnum. All right. Then, if you remember, I gave you the mnemonic ROS, Anyone remember that? ROS? With the 3 foramen here. Maybe from your area you can see them. 1, 2, 3. Foramen rotundum, foramen ovale because it's oval, and this is the tiniest one, spinosum. Yeah, foramen spinosum. So ROS, guys, ROS. Okay. Now we have 2 fissures. I'm gonna cover this because you can see them also from here. Okay. Look at the orbital cavity. Okay. You can see 2 fissures, superior orbital, inferior orbital. They can like transect. Okay. I also see, what's the foramen? The rounded one. The one I told you can see it from here.
The ocular?
The optic.
Optic.
Not ocular, optic.
Optic.
For vision. Optic foramen. All right? Here is one and here's one on each eye, and they cross here in the optic chiasma, as you remember. All right? Now, do we have more foramen here? We have one supraorbital. I see you see notch only because there is a ligament here in real life. With the ligament, it will be what? Complete foramen, correct? But after death, it will be gone. Yeah, so that's why you're not seeing ligament here to make a foramen. So supraorbital, supra means above, orbit, above the orbit, foramen. Do we have more?
Oh, down here.
Very good, infra, which is below, infraorbital. So supraorbital, infraorbital, and the 2 fissures and the optic foramen. And I want to add one more. The one we talked about. Where is the tears going to go?
Oh, the black
Nasolacrimal duct, exactly. You see it? Nasolacrimal. And you're done with the orbit. All right? Nasolacrimal duct. See it from here. Okay. So we're done here, we're done here. We can go here now. Middle cranial fossa, as I told you, ROS, ROS. Then you go medial, you see one here and one here. The most medial, leave ROS. It's kind of like a curved line here, you see it?
Yeah.
Curved like this and like this. Go medial, you see 2. Okay. Now this, if you look at it, guys, can you give a shape of it? This or this? I don't think. It's correct? You can describe it. It's not rounded, it's not oval, it's not tiny like spinosum. So it looks like lacerated wounds. That's why they call it lacerum. What's lacerated wound? You have a sharp machine and just take your skin out. You're not gonna have a clean cut wound. So they call it foramen lacerum. We're done with this area now. All right, let's go here. Strongest bone here, petrous temporal bone. And what's unique for it, you're gonna see the internal auditory meatus. So this is the strongest bone. Inside it, you're gonna have the one I talked about today, the cochlea and semicircular canals and the tiniest bones of middle ear. They're all protected here in the strongest bone of the skull. We call it petrous temporal bone. All right? Now you're gonna see the second biggest foramen. What's the biggest vein in your neck?
jugular.
Jugular, so jugular foramen. And then you're gonna see here, from your area, hypoglossal, hypoglossal. See here? Hypoglossal canal. It starts foramen and continue as a canal. And you also can see it from here, see, and from here. So we have a hypoglossal foramen also required. All right, and foramen magnum, and I think we're done with the base. This is the hardest usually. Plenty of things here. Mandible, okay? Before I go to the mandible, don't forget the maxilla. Don't forget the perpendicular plate of ethmoid. All right? And what's the notch here? Start with the V. Vomer. Go back to your list. It's good this can, energize you for the quiz. So when you go home, look at it. That's a vomer. Maxilla. Okay? The teeth, the mandible here. Gonna go over mandible since it's here. Coronoid process and mandibular or condyloid process. Condylar okay, or mandibular, whatever you want to call it, because it goes into mandibular fossa of the skull, and is this also required? See, make your TMJ. So mandibular fossa, mandibular or condylar process. Now for the mandible ramus, body, angle. How many foramen we said in the mandible? Two. Okay. Mental means what? Chin. And the one from inside? Mandibular. Mandibular foramen. That's it. So remember, two foramina, two processes, and then the parts of the mandible, and you should be done. We have one thing, I think, alveolar process, I believe. Just look it up. Just, a bumped part, which you can see it here. Yeah, you see that area? Alveolar process, just bumping in the bone here. Yeah. So when you have the mandible by itself, you may see the mandible by itself, by the way, and the skull by itself. And you may see this by itself to know the sutures. I can make a variety of questions. Now, let's go to the side. Okay. Here we have a process, okay? And this is, what bone is that? Okay. And we have the zygomatic process of temporal, which is this one. And we have temporal process of zygomatic. Again, zygomatic process of temporal, correct?
Yes.
Yeah. And then temporal process of zygomatic. Yeah, you go back to the original bone. And they meet together with the suture. You don't need to know the name of the suture. Yeah, if you look here, you can see, I don't know, the line. Yeah, the line, yeah. They meet together. But don't worry about it, this one. The concha, you see middle and inferior only. We do not see the superior concha, the swellings on the side of the nasal area. See them, swellings? Only you see middle and inferior. Why? If I do the mid-sagittal here, you can see the superior. We have three actually on each side of the nose. Okay, now let's go to the inferior. We're done after that. Okay. Same thing for the foramina. From here or from here, you should know it, oval. Okay, remember? Ross, that's what we said. Okay, so R-O-S, so I'm in oval. And the one after that is spinosum, which is here, just below spinosum. Now you need styloid process, mastoid process, two here, you see, the pointed one is styloid and mastoid, external auditory meatus, and carotid foramen becomes canal, you see? That's the carotid. This is the carotid, all right? Okay. And what is this next to the carotid? Here, I'm in what? Here's the carotid. What's next to it? Oh, look from here.
Oh, it's
The second biggest, yes, jugular. Very good. Yeah. See, carotid. Here, carotid, jugular. All right. So those required. And there is a foramen here. Can you see it, guys? This in between what? If I ask a question, in between what?
styloid.
Foramen. That's it. Stylo, mastoid, foramen. Name it based. If you know those, you know the foramen in between. So that's the easy way to remember it. And those, we call them what? There is something here in the back before I forget, then I go to those. There is lines here, guys. You need, yes, superior nuchal line. Occipital protuberance. Okay, let's put this back because we're done with that. Okay, this is the one that I told you can feel it from the back. It gives actually insertion attachment to the neck muscles as well as trapezius. Yeah, so trapezius also attached to it. So occipital, external occipital protuberance. This is on your list also. Then you have superior nuchal line. See those lines? Inferior nuchal line also gives attachment to muscles. Superior, inferior nuchal lines, external occipital protuberance. Okay? Occipital condyles, like an almond shape, you see them? They sit on what?
The foramen magnum.
No, foramen magnum is in between. On what?
C1.
On C1. Those one articulate with C1. And those help you to say what? Yes or no?
Yes.
Yes. Yeah. Flexion, extension. Yeah, you remembered the lecture, right? And I think the only thing is the palate. Don't forget. That's the palate, which is here. Hard palate and then soft palate. Yeah. And I think we're good. You see the bulging here? Alveolar process, yeah. That's the one I told you. You can see it when we go. I think we covered everything so far.